Welcome to High Sobriety. Our goal is to save lives and remove the stigma of addiction. Here's the host of High Sobriety, John Mabry.
Hi, thank you for listening to Addiction Campuses High Sobriety Podcast. I'm your grateful recovering host, John Mabry. Today, we are going to be talking about something near and dear to our company's heart. It is an initiative that some of our folks have put together. And in response to the alarming number of overdose deaths in Ohio, the Bluffs is a drug and alcohol treatment facility operated by us, Addiction Campuses. We're reaching out to help in a new way. Now, we got mobile crisis teams from the Bluffs. They're going to be putting out hundreds of Another Chance cards, is what they're called, in the hands of first responders in Columbus and Cincinnati. On the cards that these first responders are going to have, they're going to have Addiction Campuses hotline number and a message that says, "You have been given another chance." So we have the National Institute of Drug Abuse says that Ohio is one of the top 5 states with the highest rates of opioid-related overdoses, with over 3,613 such deaths in 2016. And so a lot of these folks who, if you don't know, if you're new to some of this, if you don't know, you can bring people back from an overdose sometimes with a medication called naloxone. So these first responders come up on a scene. Somebody has overdosed, an opioid-related overdose. They can shoot naloxone up their nose, and it can bring somebody back from the brink of death. Now, when first responders are doing this, now they're going to have a card from Addiction Campuses that's going to say, "Hey, you've been given another chance. Don't waste another moment. Call in, and there is treatment available." And I'm really, really excited to bring on Krista Sweet, is our treatment specialist in the Ohio area. And we've also got on the call Jason. Now, Jason has been a first responder in Ohio for over 7 years. He's a medical health technician at the Bluffs, and he's treated multiple overdose deaths and that are been impacted there in Ohio. So thank you guys so much for being on the call with us.
No problem. Glad to be here.
Awesome. So I'd love for our audience to get to know a little bit about each of you real quick. So take a couple minutes to start off. Ladies first. Krista, you mind telling us a little bit about yourself, what brought you to Addiction Campuses, and what you do on a daily basis, and why you stayed with the company?
Yeah, so I have been with Addiction Campuses for a little over a year. I started right before we opened the Bluffs. So they brought me on to be a treatment specialist here in Ohio. So what I do as a treatment specialist is basically bridge the gap between somebody who's in active addiction to treatment. So I work with patients that are seeking services, and I connect them with either our program, or if they're not clinically a good fit or need a different level of acuity, then I also work with other programs and just getting that person the help that they need. I also work with referral sources to educate them on what Addiction Campuses does, all of our programs, and primarily the Bluffs here in Ohio, so that they know that, what kind of patients to refer to us, and, what we do at the Bluffs and what makes us special and different from maybe some of the other providers.
Well, do you mind touching on that real quick while we're on the topic? What does make the Bluffs, Addiction Campuses facility stand out over some of the other ones there in the area that other people might have, quick access to? What makes us stand out?
So we at the Bluffs have a curriculum that's based on a balanced life. So all of our patients are introduced to this curriculum when they come in to treatment. And so we address basically the whole person. So we talk about their family relationships, their work relationships, finances, their health and well-being, their interpersonal relationships, and spirituality. And so we touch on all those different things. So it's really comprehensive. It's a very comprehensive treatment curriculum. And our patients respond really well to that. We don't just focus on, the substance use only. Another thing that's really fascinating about us and what we do that a lot of places don't do in general, in treatment in general, is we specialize in treating pregnant females. So we've seen a large increase in pregnant females that need treatment. And they really are a priority population. If anybody ever needed treatment, gosh, a pregnant female, it should be a priority. And so our doctor at the Bluffs has embraced that, and we've come up with, a protocol to give them the appropriate care that they need for the mother and the developing fetus and the baby. And that's been a really successful program for us. I'm really excited about it. We have an OBGYN that we work with. They get the first week of their treatment, they get a ultrasound. They see our doctor, nurse practitioner every day while they're in the program with us. And we are able to focus in on their specific needs. So we talk about parenting and postpartum depression and all the different things that, someone who's expecting a child would need, in addition to someone who's in early recovery. So it really is a special program that we have there.
Very cool. Yes, that is very, very proud to be part of a company that addresses those unique and special needs of that population. Before we get into Jason here real quick, I do want to point out that we're doing this podcast as part of the Another Chance campaign. Addiction Campuses is going to kick off a 5 cities, 5-day tour, and it's coming up right here September 3rd through the 7th, 2018. Our public outreach team will travel across the state in an RV with stops in Cincinnati, Columbus, Toledo, Cleveland, and a final stop right across the border in Pittsburgh, Pennsylvania. At each stop, we're going to have food and games and giveaways and educational materials. We're going to have our trained clinicians. Krista will be around, I believe, on site to help provide mobile assessments about treatment options for families or individuals in crisis. And we're going to have guest speakers will be announced as those dates get closer. Real quick, the first date, September 3rd, we're going to be in Cincinnati at Lyle Park Historic District. September 4th, going to be in Columbus at Dodge Park. September 5th, moving over to Toledo at Middle Grounds Metro Park. September 6th, Cleveland at Willard Park Meditation Society. And the last stop in Pittsburgh is going to be at Schlenery Park on the 7th. So, Jason, hey, dude, you've got an incredible story. I love what I've heard of your story, and I'd love for you to take a few minutes to tell folks what made you get into the field of work that you're in. How did that happen? How did that come about? And what do you do today for both Addiction Campuses and your other jobs?
Okay, so first of all, what made me want to get into my field is I've always wanted to be some type of emergency service since I was 4 years old, running around the house making signs. So I grew up and I got the opportunity when I was in high school to go through a special program, which I was able to graduate high school as a certified EMT and certified firefighter in the state of Ohio. So I did that, so then I entered that field. And, from day one, I loved being an EMT. I loved being out there helping people. I didn't always know that I would love dealing with addiction until I started dealing with it so much on the ambulance. Unfortunately, I've seen a lot of it really, really quick in my early career. And then I got this opportunity to work at the Bluffs as a medical health technician. What I do there, I assist the nursing department in checking on the patients, doing their vitals.
And so, did you play football? Was that a part of your? Oh
yeah, I played football from the time I was able to play football till I was a senior in high school.
So, and did I hear correctly that you had an opportunity to go play D1 football, and you turned that down to go to school so that you could go help save lives?
Oh yeah, I had an opportunity to go to college to play football. I was horrible at the game of football, but I just felt I didn't need to go anywhere else. What I wanted to do with my life was go play, go work as a EMT and just try to save lives and be out there for the community.
So, man, I think it just shows the kind of character and the heart that you have, that somebody that could go and play D1 football, possibly on a scholarship at a big university, actually, took the opportunity to say, no, I'm not going to do that. I'm going to go a different route. And what a difference you're making in your community there. So you're not just working as for Addiction Campuses, the Bluffs facility, but you're also 911 dispatcher and a volunteer firefighter. Is that right?
Yeah, that's correct. I'm a 911 dispatcher and a volunteer firefighter, and I'm still an active EMT on the ambulance. Till this day, I run all my days off between the 911 center and the Bluffs.
Man, we are so honored and lucky to have you on our team, both of you guys on our team. And I just point out on a personal note, really proud to have Krista on the call with us today. She's right after she got hired with Addiction Campuses, found out that she had cancer with a newborn baby, and I think recently married at the time, if I'm not mistaken. And so Krista, we're so glad that you guys are both here and with us.
Yeah, thanks.
So tell us a little bit more. How did the Another Chance campaign start? I mean, this is going to give folks an additional resource that they don't have, because I imagine families or individuals who experience an overdose in their home or in their car or in public, gets emergency response teams to come help, and then they're kind of sent back out into the community. And if the hospital or case managers don't give them any resources, this is another line of defense that we're going to have available for first responders. How did this initiative come about? Was it your idea, Krista, or somebody else's?
So actually, Melissa Towns, our Director of Strategic Development, she came to me with the idea, and immediately I was like, yes, this would be a great thing for us to do here in Ohio. We were really seeing a huge amount of overdoses over the last, several years. It just seems to be continuing. Right now, we haven't really seen a decline in the amount of overdoses happening here, unfortunately. So there's still a huge need for us to connect people that are survivors of overdoses to treatment. And we found that there aren't a lot of, now there are some, but there are a lot of first responders that aren't doing really anything as far as resources go whenever they revive somebody from an overdose. So a lot of times they're taken to the emergency room, and that's pretty much it. And sometimes in the emergency room, the patient decides just to leave. They're not required to stay. Like, once they've been revived, they can just go. So we're asking first responders to give them this card so that they know that they do have options. They can call us. We'll work with them. We'll work with their family. Even if the patient doesn't want to, give it to a family member or a friend, and hopefully we will be able to touch that person's life and help them. And really just bridging the gap so that, when you bring somebody back to life, that's an amazing thing to do. And so we want to make sure that that person uses that opportunity to get recovery. And so just working with the first responders, educating them on what we do as a treatment specialist, connecting, an individual with all their options and services that are available. Because there really isn't a one-size-fits-all with treatment. We would love to say that the Bluffs, would be able to take every single patient. But the reality is that there's a lot of providers that do different things. And, there's some times where we connect the patient with another provider because it's the best thing for that patient. So really just understanding, and getting to know. So what I've been doing is just, introducing this to the first responders. Primarily, I've dealt with emergency rooms and fire departments, because a lot of the fire departments, especially in Cincinnati and Columbus, they are literally the first people to get there. They're the ones who are responding to these overdose calls, and all of the fire departments are also EMTs. So, some of them, are really embracing this idea, and we're kind of going through the chain of command and working with the chiefs to get it instilled so that it is something, a protocol that they can follow. The emergency rooms have also been really embracing this idea, because they don't have, our card is really nice because it's a plastic, it's almost like a credit card. So it's not flimsy. They can hold on to it. It's not going to rip or fall apart. It's really easy just to hand it out, and hopefully the patient will use it right then, but they can always just take it with them, and it's when they're ready, they can make that call.
Nice. Real quick, I want to put out a couple of phone numbers. If something here is resonating with you already in this podcast and you want to call in and talk to somebody about yourself or a family member that might need help, you can call in at 844-888-HELP. That's 844-888-4357. And that'll connect you with the treatment specialist at Addiction Campuses. Krista, are you willing to give out your number for anybody in the Ohio area that might want to talk to you directly?
Yeah, absolutely. I could be reached. My cell phone number, my direct cell phone number is 724-614-2457. And I always answer the phone, and I'd be happy to help anybody that is reaching out for services in Ohio.
Awesome. And because I've done a few radio and podcast interviews, can you say the number one more time in case somebody didn't get it the first time?
724-614-2457.
Awesome. Thank you. Jason, in terms of, what a first responder comes up upon. So you've been on numerous calls where somebody's overdosed and you've been a part of caring for them. Take us through what a typical call sound. A call comes in. What is it like on your side? What's it like on an EMT or a firefighter side? Can you take us through what that process is like to get to somebody to administer what needs to be administered, and then where do you take them from there?
Right. So the way we're seeing it, we arrive on scene. There's always family there. They're torn apart because their family member has overdosed and they think they're going to die. So not only are we trying to treat the patient, we're trying to get the family to calm down so that way they can give us some space and allow us to do our job. So then obviously we assess the patient, make sure, you're always going to towards an opioid overdose. And once we realize it's opioid overdose, then we'll administer the drug Narcan, which we do it multiple ways. We do it either through the nose, we do it nasal spray, or we can do it through the vein, through an IV. So we'll give them Narcan, and hopefully, that'll wake them up. Once they're awake, then of course we take them down to the hospital, down to the ER. And unfortunately, like Krista said, that's about an extent of what we were able to do up until, of course, the Bluffs came, and now that they're doing this outreach program, we can now refer our patients to them. But at that time, we can only treat them with Narcan, transfer them to the hospital, and then we leave at the ER, and that's the end of our contact with that patient.
Okay. What does a scene typically look like? I want to kind of get into your world just a little bit more. What does the scene look like typically when you come up on it? What kind of feelings are you feeling? Adrenaline pumping? Are you nervous, or are you just you're on point? You know exactly what you're doing, and you get it done. I'm just thinking, man, if I got a call and if somebody's life was in my hands, I don't think I could handle it. So that takes a special person. What's that like for you? What's that like for you to go on a call and arrive there on the scene? And can you take us into kind of your world a little bit deeper?
I mean, when you arrive there, in all honesty, the patient does look like he's dead or she is dead. So then you have that little nerve, like, can I save this patient? Is this patient going to die right in front of their family? It's part of my job to save them. I don't want to let this patient die. So then you got to reach inside and grab that. I got to do my job, and I got to treat this patient. I said, you tell yourself, I can do this. I got to do everything I can do. Unfortunately, I can't play God, but as long as I do everything I can do, then I know I did everything I can do. So, and then once you treat the patient, the patient starts coming back. It's not an instant thing, Narcan. It's over time. They'll start breathing better, and then they'll wake up. So once they start breathing better, then that feeling that you actually saved somebody's life comes inside of you, and that just carries you throughout the rest of the treatment.
Nice, man. Yeah, I've never really talked to anybody that's been and experienced it firsthand like you.
Right.
Do you find, in your opinion, is Narcan
Well, my thoughts on Narcan, it's part of the solution. But unfortunately, this goes back to what Chris was saying, the EMTs and firefighters never had the resources. So it's only a part of the solution. We need the other half of that solution. So now that we're only using that first half of the solution, people are thinking, well, I can get high and overdose and they'll be there to save me. But without that, that second part of that solution, able to talk to them and tell them, hey, you need help. This is a good place. You need to call them, get the help you need. This is the second part of your solution. One day we may not make it there in time. So I think Narcan is important to have, and it is part of the solution, but it's not the solution.
Nice. Yeah, I agree. It's not, at least give somebody another chance. At least give somebody, another chance to go get the recovery that they need. Narcan's being put out there across the country to help save lives. And then, I think you're exactly right, man. Just the next step. Okay, don't just bring somebody back and leave them. Bring them back and go, hey, dude, there's help available. There's options available.
Right.
Krista, somebody calls in and they have no resources, they have no insurance, very little money, and they call you, they need help. What are you able to help them?
Yeah, I am. In Ohio, actually, a lot of the counties in Ohio, the Medicaid system here has really advanced up in the last couple years. A lot of people can apply for Medicaid online and get immediate approval. So they don't have to wait. It used to be in some counties, especially like the most populated counties, it could take up to 45 days, sometimes 90 days to get approved for Medicaid. And obviously, that's just unacceptable when you have somebody who's in crisis who needs treatment right now. So we can get them approved for Medicaid, usually within 24 hours, have them approved. And then there's lots of places that I've connected with that can do detox. So there's a lot of places that have opened up in the last couple years that have detox beds and that are continuing to expand on those detox beds. So getting somebody into detox is usually not a problem. What I usually struggle with in connecting with resources is actually finding some of the providers that take Medicaid do not have residential treatments. So there's kind of a missing link there. They go, if somebody does not need detox, sometimes there is a waiting list to get them into a residential longer-term program, which hopefully I think there is some movement in the state to change the regulations, because there's been in Ohio, there is a limit on how many beds a provider can have. And so 16 beds was like the maximum you could have for detox or residential treatment. And so I think that's changing now so that people can open up more beds and have, we're in a state of an emergency here. So they were kind of forced to change that. And so providers are in the process of expanding to accommodate, the big need that we have for treatment in Ohio.
Nice. So, yeah, man, if somebody needs help and they don't have a whole lot of resources, they can still give you a call, give Addiction Campuses a call, and we will help them find a solution, a resource somewhere, somehow.
Yes.
I think for so long, people just, the stigma of addiction, we talk about this all the time when I'm going out and doing talks, the stigma of addiction, I think it kept me from coming out and asking for help, and so many other people we've got, so if somebody had cancer and they kept relapsing in their cancer, would you like give up on them and say, oh, you know what, don't go get chemo. You just stop the chemo, just stop the help. You don't need that. Cancer's just going to go away on its own. No. So if somebody has been through treatment before, somebody's been through treatment 8-9 times, don't give up on them. Don't give up on them. There is help out there.
Yeah, the stigma, that's one of the big things too that I, as a treatment specialist and just a recovery advocate, that it always boggles my mind when I read stuff online, people, because if you read it, if there's ever a news article about opiate overdoses, if you look into the comments section and you're a recovery advocate, you're always going to get angry because you see the comments that people make that are just so heartless and people just don't have the empathy and compassion for this population, but they don't understand that addiction does not discriminate. It can happen to anybody from anywhere. And, these are our children, our brothers, our sisters, our parents. And everybody deserves medical treatment. Me as a cancer survivor, I absolutely hate whenever people use that comparison. It's like, that it's not a disease, that they compare it and it's not, I think I saw somebody said, well, we don't give cancer patients, free treatment. And I'm like, if somebody is having a medical emergency, their job as EMSs and first responders is to help that person no matter what the reason is. So if it's cancer, they're going to treat them. If it's an overdose, they're going to treat them. That's their job. And I just don't think it's, right for there to be any sort of discrimination when it comes to somebody that's experiencing a medical emergency, no matter what it is. And
yeah, I feel like we have so many more overdoses that they're always, out there and reoccurring. So, some individuals, again, 7, 8, 9, 10 times overdosing or going to treatment, or maybe somebody who hasn't gone to treatment, but there's such a high rate because people don't come out of the shadows and share it, and that's one of the, I guess, negative things that I don't like about the 12-step community, although I love 12-step work, and that's something that I participate in as part of my recovery. The one thing is it's always been anonymous. There's Alcoholics Anonymous, Narcotics Anonymous, these programs out there. And so for so long, it's like that was the one place that you could go and be accepted, completely accepted for how you are and the struggles that you're having that day. You could go and get support for that. But then, they're just in, a church basement, or they're just in a office building somewhere 1 hour a day. And I found that I couldn't share my truth for just 1 hour a day in a room with people and then go 23 hours for the rest of the day and cover up. I don't want anybody to know. Nobody needs to know this because I'm embarrassed and they're going to look down on me. They're going to think I'm weak and they're going to think that I'm just a screw up. I'm the black sheep, of the family, and what am I doing to my family and things like that. But by having these conversations, by talking openly about it, it's like, guys, if you're overdosing and you're not getting help, and maybe it's time to pick up the phone and get help today. Today is maybe the day that you call in for the first time and not be ashamed of your past, but feel a sense of hope and relief by reaching out for help. So again, if you something's resonating with you here, please call in to our call center at 844-888-4357. Jason, hey, I want to go back to you. Thank you for being patient with us here. I want to ask you, how often do you see overdose calls these days, or the department that you work with? How often are they responding on a daily or weekly basis right now?
We actually see them quite often. We see them probably at least 5 or 6 times a week, if not more. There for a while, I was going just about every shift I worked that I had an overdose. So it's very often we see them, and fortunately the area I work was hit really hard with drugs. It's actually, they said it was one of the gateways into Ohio that they transport drugs. So, we were seeing it constant, and we still are.
Now, do you see are different departments in your area combining forces more these days to try to alleviate some of this issue? Are you guys working, because one department or one part of a, city's response team can only do so much, but do y'all have meetings, or do your, leaders have meetings with the chief of police and chief, fire chief there in town to collaborate more closely?
Yeah, look, the ambulance company I work for in the city of Liverpool is where I work. They've actually begun to have a whole program. They recently released a video about the opiate problem in East Liverpool. And I don't know if you remember the big picture that was released. It was all went viral across the country of the kid that was in the back seat, and both the driver and passenger were overdosed. That started it, and fortunately, the community there has actually came together. The police, fire, and EMS are all trying to work on, getting rid of that problem.
Nice. I think I want to point this out again. I can't stress it enough that this problem with increasing addiction in our country is not going to go away on its own. And the people who are suffering from the disease of addiction are not going to get better on their own. People with cancer don't get better on their own. It takes a team of doctors and support group and family and church and, community. It takes being connected with other people to help individuals struggling with the disease to get through it. And same thing with addiction. Again, going back to the stigma, can't stress it enough that we for so long just look at the people as, hey, they're making the bad mistakes. It's their choice to overdose. It's their choice. I had a choice early on whether to abuse alcohol or prescription medications. Yes, I had a choice, but then all of a sudden there's a tipping point where it becomes kind of like I have to do it until I get help. And so you guys are doing amazing work out there to try to help alleviate that stigma. Just I'm one voice, you're one voice. You guys each have your own voice, but collectively, when we put it together over a longer period of time, hopefully we can help our country begin to see some relief from this problem.
Recently, this past week in Cuyahoga County, which is where Cleveland is located, there was 14 fatal overdoses in a matter of 5 days. And the coroner, the medical examiner of Cuyahoga County, released the data on these. Now we're still waiting to find out exactly what substance it was. I mean, we're assuming that it was like fentanyl or carfentanil, but they haven't gotten the toxicology back yet from all of the overdoses. But the interesting thing about it was that the demographics of these victims, 50% of them were over the age of 60. So it was just a different, typically they see, I guess the most common demographic is age 45 to 55. And so this was largely an older demographic, which I think, goes against some of the stigma that's out there. They think it's all these young kids, but really it's everybody. I mean, the oldest person that overdosed was 77 years old. So it's just, and it's alarming. Another thing that was alarming about it was that it was evenly distributed throughout the whole city of Cleveland. So there wasn't, usually a lot of times they see overdoses happen in kind of clusters in one part of a city. And this rash of overdoses was everywhere. It was on the east and the west side, which Cleveland is kind of divided up by that. And there was just as many on the west side as there was on the east side. So there was no central area where these overdoses were happening, which is another interesting piece of data from this.
Well, we had a lot of the more younger generation. We had around late 20s to 40 years old. Is more where we're at. But like Krista said, it does happen in clusters. It'd be in this one section of the city is all your overdoses this week, and next week it's in the other section of the city. I mean, it just depends on where it happens.
Man, I gotta say, I'm glad I don't have your job. I really respect both of you. Both of you have touched more lives than you know. I hope that you guys continue to make a difference out there in your communities. I'd like to wrap up with our 5 cities 5-day tour, again coming up on September 3rd through the 7th, 2018. Our public outreach team is going to travel across the state to Cincinnati on September 3rd at Lyle Park Historic District. We're going to be at Columbus at Dodge Park on September 4th, September 5th in Toledo at Middle Grounds Metro Park, September 6th, we're going to be at Cleveland Willard Park Meditation Society. And on the 7th, we're going to be in Pittsburgh at Schindlery Park. So if you guys want to come out, we're going to have free food and games, and it's going to be a supportive environment for you to come out and maybe ask for help for the first time, or bring somebody in your family that might need help for the first time. Talk with folks like Krista who can help direct you to a resource and possibly treatment if that makes sense for you. Like to wrap up, Krista, is there anything else that we haven't covered that you'd like to say? I'd love for you to plug your cell phone one more time if you're willing to do that, if for anybody in Ohio that wants to talk to you directly.
Yeah, so I can be reached by cell phone at 724-614-2457. Again, that's 724-614-2457. That's my direct cell phone number. I'm here in Ohio 24/7, available to help somebody.
Awesome. Thank you. And Jason, hey man, thanks so much for being on the call with us today.
No, it's no problem.
Man, your experiences and your knowledge and your heart and compassion really stands out, and it's something that we know working for Addiction Campuses, from our CEO down, we operate from a heart of compassion, and that's one of, in my opinion, the biggest differentiator between us and other treatment centers. As I've been through other treatment centers, and I did not get the level of care and compassion and love when I was on campus in treatment at one of our facilities. So if you're looking for help, this is a wonderful place to look at. And again, if you want to call in to our call center, you can do that at 844-888-4357. Krista Sweet, Jason Miller, thank you guys so much for being on Addiction Campuses High Sobriety Podcast. You guys keep up the amazing work you're doing out there.
Thank you.
Yes, thank you.
Thank you for listening to High Sobriety. If you or a loved one are struggling with an addiction, we can help. Call our hotline at 844-888-HELP. That's 844-888-4357. Don't wait. Call today, 844-888-HELP. High Sobriety is an Addiction Campuses podcast.